Okay, today we'll know about a brief overview of murmurs at MBBS level. So, what is a murmur? Murmur occurs whenever there is turbulence blood flow. Whenever there is turbulence in blood flow, normally the blood should travel in streamlines. So, whenever there is turbulence in blood flow, if the blood encounters some obstruction, then there will be turbulence. So whenever there is turbulence, there will be murmurs. So murmurs are of two types. It can occur in systole or diastole. Systole means when the heart is contracting. Diastole means when the heart is relaxing. Systolic murmurs always occur between S1 and S2. Systolic murmurs always occur between S1 and S2. This is systolic murmur. Whereas diastolic murmurs occurs between S2 and S1. Between S2 and S1, diastolic murmurs occur. Now, what are the causes? Causes of systolic murmur. In systole, the heart has to pump blood out. The ventricles should pump the blood out. So from left ventricle, it should go into aorta. So, but if there is aortic stenosis, the blood cannot go. So there is turbulence. Turbulence happens when there is aortic stenosis. Then here, if there is mitral regurgitation, then whenever the left ventricle contracts, blood might go into the left atrium during systole. Then again, MR is the cause. Then if there is VSD, ventricular septal defect, then also the blood turbulence can develop, leading to another reason, ventricular septal defect. And the last reason is whenever there is pulmonary stenosis. So when the right ventricle contract, if the blood is not able to go into the pulmonary artery, pulmonary aorta, because of pulmonary stenosis, then we will be able to hear systolic murmur. Systolic murmur. Coming to diastolic murmur. Diastolic murmur occurs during diastole. So after systole, the blood which is pumped into the aorta or pumped into the pulmonary aorta, it should remain in them. It should remain in them. If it is not remaining, then it means there is aortic regurgitation, there is pulmonary regurgitation. Then again, during diastole, the blood should travel freely from atria to ventricle. From atria to ventricle. If it is not traveling because of mitral stenosis or tricuspid stenosis, then in all these four reasons, we will be able to hear diastolic murmurs. So systolic murmurs causes are these four, and the diastolic murmur causes are these four. So systolic murmurs can be normal as occurs during high output states like pregnancy, edema, etc. But diastolic murmur is always pathological. If you remember these four causes, you will never get the question wrong on murmurs. So systolic murmurs, diastolic murmurs.